Welcome to my DVD on performing overhead squat. The aim of this DVD is to elaborate on the overhead squat and its purpose, also its relevance to sport, warm up for the overhead squat, and the coaching points and techniques, also the common faults and corrective exercises, regression and progression, and cool down. The overhead squat is a very complex exercise that requires the optimal amount of mobility, flexibility, strength, and stability. As with all movements, it is also the great tool to test the body's ability to maintain a good form under greater demand when load is placed overhead. Some athletes may be discouraged from performing this exercise because of flexibility issues. According to Loren and Chu and Goulet et al., overhead squat plays a key role in developing and maintaining the important qualities of ankles, knees, hips, spines, and shoulder complex flexibility. Not only that, it improves the strength element of the fitness component of the lower and upper extremity musculature. According to the National Academy of Sports Medicine, the overhead squat has been an effective tool to determine the patient's movement and neuromuscular control in the rehabilitation environment. According to Loren and Chu and Goulet et al., muscle involved on the lower body are gastrocnemius, soleus, hamstrings, quadriceps, and gluteals. Also, according to Voigt and Ronai, the muscle involved on the shoulder complex are rotator cuff muscles, which are supraspinatus, teres minor, infraspinatus, and subscapularis. Also, scapular muscles are upper traps, lower traps, and serratus anterior, and scap stabilizer muscles are mid traps and rhomboids. Overhead squat should be encouraged training on the weightlifting platform with bumper plates rather inside a power rack. This is to accommodate the mislifts while minimizing the risk of injury to the individual and damage to the floor and equipment. Overhead squat is widely being used within S&C programs, also within the Olympic lifting competitions. Overhead squat movement is adapted in various sports to execute the task in most efficient manner. Variations of overload lifting within the weight room include vertical pressing, vertical pulling, and Olympic style lifts. The prerequisite for the overhead squat is the athlete or individual should be able to squat properly with regard to maintaining normal lordotic lumbar spine with knee aligned over the feet and flat feet throughout the movement. This is to avoid or minimize any further impairment and not to compromise with the individual's health. It is imperative that the individual with the glenohumeral joint injury should seek advice with medical team prior to attempting overhead squat. During the warm-up phase, adopt stance hip width apart, engage glutes and core to maintain neutral pelvis and lumbar spine respectively. Snatch grip on the pole and carry out the exercise as per the demonstration. The general purpose of the warm-up is to stimulate blood flow to the periphery, to increase body temperature, and to enhance free coordinated movement. Also to improve knee joint position sense, to increase oxygen uptake. By doing demo as per video will loosen off the stiffened joints and musculature, facilitating the activation of rotator cuff and joints during the overhead squat. According to Macmillan et al., dynamic and progressive movements, warm-up that mimics the main activity or exercise without inducing fatigue might be better for enhancing performance. The load is unracked safely and placed either on the front squat position, which is just above the anterior deltoid, or on the back squat position, which is just above the posterior deltoid. The grip is overhand snatch grip hand spacing. To initiate, the lift will eccentrically slightly flex at the knees and explosively extend, throwing the barbell to arm's length, locking at the glenohumeral joint, elbow, and neutral wrist position. From the lateral view, the barbell should be positioned above the glenohumeral joint in order to maximize the co-contraction of the musculatures. The athlete adopts the stance phase with feet hip width apart, toes slightly externally rotated. The descent phase is the most crucial part of the overhead squat. The main effort should be on maintaining external rotation at the glenohumeral joint, as you can see on the right hand side, armpit facing forward. The descent phase is initiated by breaking from the hips, followed by knees simultaneously until the quads parallel to the floor. The inward muscle undergo eccentric phase. During this phase, as you can see, the scene and the back is parallel to each other throughout this descent phase. The descent should be stopped if it compromises with the upper body posture and neutral spine. Load stays above the shoulder, also knee over the toes throughout this descent phase. The ascent phase is carried out by extending the knee and hip joints, pressing through the heels to return to the start position. The inward muscles undergo concentric phase. These are the small list of some of the common faults that we see on a daily basis when athlete performs the overhead squat. So my aim on this presentation is to highlight these issues and approach with the corrective exercises. Medial knee displacement has been shown to predict non-contact ACL injury and PFPS, especially it occurs during landing activity. Also, the shoulder impingement is due to the reduced external rotation at the glenohumeral joint, and reduced upward rotation of scapula has been the major contributing factor for placing restriction on the shoulder elevation and may be the potential cause for the shoulder impingement and discomfort. Medial knee displacement may be influenced by the hip internal rotation tightness and adductor tightness. Also, due to the lack of neuromuscular control in the hip external rotators or abductors may contribute to the frontal plane movement of the knees. Also, the tightness of lateral gastrocnemius, soleus, and peroneal may also contribute to the medial knee displacement and dynamic knee valgus. Not only that, also could be due to the hip muscle imbalance may be the contributing factor for the medial knee displacement if it is still present after the heel lift being used. Having the TheraBand around the knees would increase the abductors activation and reducing the adductors activation. That would perhaps then reduces the overall medial knee displacement of the overhead squat. One of the common faults we can see is heel raise, and this could be due to the tight gastrocnemius and soleus. So placing the heels on the waist would increase dorsiflexion and perhaps reduces the possibility of medial knee displacement during overhead squat. As a regression, performing half overhead squat has been an ideal approach to correct the athlete's glenohumeral joint position into external rotation and addressing other flexibility issues that may arise. It can also assist in lengthening the muscle tendon unit. As a progression, once the movement is perfect, gradually reduce the hand spacing and increase the weight. It is also the precursor of the snatch exercise. Static stretching is carried out by applying the stretching force in order to elongate the musculotendinous unit and also to achieve a change in their length. usually with the purpose of improving range of motion and promote recovery. SMFR, otherwise known as self-myofascial release, has been shown to acutely increase range of motion and reduce muscle soreness without compromising the movement performance. It has also been shown beneficial for post and between the workout for recovery. Also, it has been shown to decrease DOMS, otherwise known as delayed on muscle soreness, when performed post exercise. Conclusion and the takeaway points are as follows. The athlete or individual should be able to squat with confidence. Also, any injury regarding the shoulder should be strongly advised to seek advice from the medical staff. Also, the key coaching points and techniques are to be implemented during the overhead squat through the means of relevant papers or through the qualified coaches. This concludes the presentation.